delighted to share with all of you the national plan to fighting cancer, starting by the effort the government of Rwanda has put in place in regard to prevention of cancer. We have prioritized mass campaigns across the country to make sure that everyone knows about the burden of cancer, knows how to prevent cancer, but also everyone get informed on the importance of getting screened at an early stage. Because most of the time in Africa, what we notice is that people get screened and diagnosed at a late stage, and nothing can be done. Today we have what we call an initiative we call Car-Free Day, where we exercise, everyone exercise from the town to the village. Everyone meet and we park our cars and we do physical exercises. And during this Car-Free Day initiative, we also take the opportunity to disseminate key messages around non-communicable diseases, including cancer. And we also do screening in collaboration with public hospitals, but also private clinics and facilities. They all join the Ministry of Health effort to screen people. In addition to this, with the community-based health insurance that is serving 91% of the people of Rwanda, men above 40 years and women above 35 years are allowed to do a medical checkup, including cancer screening, every year. So we mobilize people, we sensitize people so that they know that they have this opportunity. Rwanda has also initiated a human papillomavirus vaccine since 2011, and today our young ladies from 12 years old are vaccinated and the coverage is at 94%. We have also initiated the vaccine against hepatitis B, and the coverage also is good, is more than 90%. We have put in place clear regulations and laws around tobacco consumers. And we have recently banned shisha. This is around prevention, but the most important thing, we put emphasis on awareness and campaigns across the country, using our local leaders, but also using our 60,000 community health workers that have been trained on how to deliver key messages around prevention. With regard to screening, we have 50% of our health facilities that were equipped with the capability, with the knowledge, but also the equipment, the required equipment to be able to screen for especially cervical cancer and breast cancer. Those are actually the main causes of cancer we have in Rwanda. The good news is that today we have established the National Cancer Registry that will allow us to have accurate data on the prevalence and the incidence of cancer in Rwanda. With regard to treatment, that is remaining a challenge, especially because of the affordability of the drugs. And we're trying to partner with the pharmaceutical industries to ensure that Rwandans access to cancer drugs at an affordable cost, as we did for diabetes with our good partners, including Novartis. We are trying to reach out to partners to ensure that as we screen, as we put in place equipment and facilities to screen, we have an alternative to offer to people who will be screened positive for any type of cancer. So today we have equipped some of our referral hospitals and even district hospitals with means to treat for cancer. Some of our hospitals are offering chemotherapy and surgical treatment. Others are offering surgical treatment only. And very soon we will have more hospitals offering chemotherapy. We are happy to announce that we recently established a very nice facility in Rwanda Military Hospital that will be offering radiotherapy treatment to Rwandans, but also to surrounding countries. We still have gaps, we still have challenges, and we need good partners to support us to ensure that, as I said, cancer drugs are affordable, are cheap, are accessible to everyone, and we still need to train more human resource, more health providers to make sure that they provide chemotherapy as it should be. We also need to complement this radiotherapy center with a PET scan machine. They don't have a PET scan machine, and we keep mobilizing within our own resource as a government, but we welcome any support from good partners. Another good news is that recently, actually last year, during the World Health Assembly, Rwanda was included. Specifically, our Kigali city was included among the city challenges initiative, and we signed the MOU with our partners. The MOU was signed this year, in March this year, and this is a great opportunity to us because it will allow us to really assess the gaps we have in our facilities, and also it will open doors to possible partnerships to address these gaps. So I really thank you very much for the opportunity given to Rwanda to share our experience and also to learn from others. Thank you very much.